Chiesi, People and Ideas for Innovation in Healthcare. Chiesi is a leading and rapidly growing international pharmaceutical group of companies. This has been possible thanks to enduring and emergent success of innovative therapeutics in respiratory, cardiovascular, neonatology, and cystic fibrosis segments worldwide. In respiratory areas, we have introduced innovative therapeutics like Foster for the management of asthma. Foster has now been launched in 22 countries and being extensively prescribed by the physicians in the entire Europe, Central Asia, Brazil, and now in Pakistan. In most of the European countries, it is available with the brand name of Foster or Innovare, but in UK it is available with brand name of Foster. Our R&D team is developing new formulations and is exploring new indications for Foster. Asthma is one of the most common chronic diseases and is associated with considerable social burden and costs to healthcare systems. It has been described as a chronic inflammatory disorder of the airways associated with increased airway hyperresponsiveness and airflow limitation. Latest development in asthma management has been described by a GINA guideline. GINA strongly recommends inhaled corticosteroids and long-acting beta agonist in step 3 and 4 of asthma management approach based on control. Foster is a new extra-fine formulation of beclomethasone, a time-tested ICS and formoterol, a LABA with quicker onset and prolonged action. Foster delivers 100 micrograms of beclomethasone, which ensures effective anti-inflammatory activity, along with 6 micrograms of formoterol, which confirms long-acting with fast onset of bronchodilation. About 42.8% of the delivered dose is available for inhalation. Foster is an innovative product based on Chiesi patented Modulite technology, through which this extra-fine formulation has been developed. Along with modulation of extra-fine particle size, Modulite technology also permits in modulating the speed of the aerosol droplets, as speed of the aerosol droplets play a very vital role for better inhalation. So Modulite technology in Foster ensures reduced speed of aerosol and increased plume duration. The delivered BDP dose in Foster is around 84.6 micrograms, whereas the FPD approximates 36.1 micrograms. This means that the 43% of the delivered dose is available for lung deposition. The extra-fine particles in Foster are approximately half the size of other fixed-dose combination products, as shown in this graph, which confirms high lung deposition. The mmAd of beclomethasone dipropionate in Foster is about 1.4 micrometers, whereas of formoterol is 1.5 millimeters. The extra-fine formulation means 100 micrograms of beclomethasone dipropionate in Foster is equivalent to 250 micrograms of conventional BDP. The amount of drug reaching to the lung is same for Foster delivering 100 micrograms of beclomethasone dipropionate compared to non-extra-fine formulation of beclomethasone dipropionate delivering 250 micrograms, while extrathoracic deposition of the drug is more for non-extra-fine beclomethasone dipropionate compared to Foster. Therefore, with extra-fine formulation of Foster, asthma can be treated with lesser dose of ICS. Extra-fine formulation of Foster allows uniform treatment of inflammation and bronchoconstriction both in the large and the small airways. Extra-fine particles of Foster can reach both central and peripheral airways, leading to a high and uniform lung deposition. As it is evident in this chart that about 2/3 of the drug will be available in the large airways and 1/3 will be in the small airways. In asthma, chemicals released from inflammatory cells in the lungs cause excess fluid to leak from blood vessels in the lungs, tightening of the muscles surrounding the airways, and an overproduction of mucus. When patients inhale Foster, beclomethasone dipropionate travels through the airways and it is recognized by the inflammatory cells in the lungs. When the drug interacts with the cells stop their production of the active chemicals causing the inflammation. Thus, the beclomethasone dipropionate is able to reduce the occurrence of the asthma attacks by stopping the inflammatory process, resulting in a decrease in the fluid and mucus buildup in the lungs and better control of asthma. Long-acting inhaled beta-2 agonists include formoterol and salmeterol, provide a similar duration of bronchodilation, that is 12 hours, but there are pharmacological differences between them. Formoterol has a more rapid onset of action than salmeterol, which makes formoterol a suitable bronchodilator for symptom relief as well as symptom prevention. They are most effective addition of long-acting inhaled beta-2 agonists to a daily regimen of inhaled glucocorticosteroids. Foster improves symptom scores. Foster decreases nocturnal asthma. Foster improves lung function. Foster decreases the use of rapid-acting inhaled beta-2 agonists. Foster reduces the number of exacerbations. Foster does not increase the risk of asthma-related hospitalizations and achieves clinical control of asthma in more patients more rapidly and at a lower dose of inhaled corticosteroid than inhaled corticosteroid given alone. This greater efficacy of combination treatment has led to the development of fixed combination inhalers that deliver both glucocorticosteroid and long-acting beta-2 agonists simultaneously. This graph clearly demonstrates that onset of action of formoterol is similar to salbutamol. In a randomized double-blind 3-month study on 228 patients of moderate to severe asthma with Foster 100 by 6 micrograms, 2 puffs BID, Foster achieves more symptom-free days and less need for rescue medications. As mentioned, 55% reduction in symptom-free days, 60% salbutamol-free days, and 73% reduction in overall salbutamol usage. In randomized double-blind, double-dummy, comparative 3-month study on 227 moderate to severe asthmatic patients. Foster is given 400 by 24 micrograms beclomethasone/formoterol and 500 by 100 fluticasone and salmeterol. Interestingly, Foster induced a faster bronchodilation measured as FEV1 over 60-minute post-dose than fluticasone propionates and salmeterol. Foster also showed significantly better morning FEV1 compared to fluticasone propionate and salmeterol. Foster is as effective as fluticasone propionate and salmeterol in moderate to severe asthma, which is evident through these PEF values. Foster enabling to achieve better asthma control versus the fixed combination of budesonide and formoterol. In a 12-week study of 219 moderate to severe asthmatic patients treated randomly with Foster, 2 puffs twice daily, and a fixed combination of budesonide 800 micrograms and formoterol 24 micrograms. Foster improves respiratory functional parameters like morning PEF1 and FEV1 measured at clinics compared to budesonides and formoterol. Foster targets adherence to therapy. Absence of immediate effect is a major reason for non-adherence with asthma maintenance therapy. Foster contains formoterol, which bronchodilates in 1 to 3 minutes. Foster may increase adherence to therapy. Foster is easy to use with simple posology of 1 to 2 inhalations twice daily. Dose can be changed according to control of patients from 1 puff BID to 2 puffs BID or 2 puffs BID to 1 puff BID. With Foster, treatment can be adjusted without the patient needing to have a change of inhaler strength. Foster is an effective combination therapy for the management of asthma because
Foster delivers greater efficacy per microgram of steroid. Foster achieves effective asthma control and prevents exacerbations. Foster confirms fast onset of bronchodilation just like salbutamol, which may increase adherence to therapy. Foster ensures better efficacy compared to fluticasone in combination with salmeterol. Foster excellent safety as no cortisol levels decrease due to lower steroid intake.